Check out this episode of Cutting Edge Health, Preventing Cognitive Decline.
You have diet, you have exercise as two of the major interventions right away if someone comes in. What's your third one?
Yeah, so it depends on someone's story. Like, we usually have to ask what's going on with people, but either sleep or stress is the third one. Sleep or stress is the third one. And usually these are pretty intertwined, because a lot of times if people are struggling with stress, and most people over the last, lived through 2020, had some, like, there was definitely a shift in sleep and definitely stress for people, like high stress or high cortisol. So stress being defined as changes in our external environment or internal environment, but typically it's our external environment that require energy, require quite a bit of energy for our nervous system and immune systems to respond to. Our minds and brains are programmed for stability and certainty. So we seek stability and certainty. We seek evidence. We seek simple answers, or predictable answers, at least, if they're not simple. And so usually we have to talk about what's stressing someone out, or why are they not sleeping. So stress can be a tricky one, because there's stress that's inherited. There might be stress that's generational, things that happened to people growing up that have been either ignored or incompletely dealt with, or and they continue to create like patterns of behavior or of thinking or emotion that can be harmful. So the adverse childhood events study, that was the original data was done, in Kaiser in the 1990s. I think a lot of people have heard of ACEs or ACE questionnaires. So let's say they've boiled it down to on some level. So there's a lot of layers to this study, but the basics is 10 questions. Like, hey, did you have someone that would hit you, slap you growing up? Were your parents get divorced? Were you around people with a mental illness or alcoholics, drug abuse, etc.? And if you get, the magic number, if you have 4 or more on an ACEs questionnaire, and you can just Google ACEs and see what your score is, like, there are all kinds of associations to diseases, disease states, or abnormal health outcomes, among them dementia. There's, according to one study, there's like a 6.5 times increase if your score was 4 out of 10 or more, 5, 6, 7, 8, 9 out of 10. There's like a 6.5 time increase of getting dementia.